My name is Laura Waghorn and I'm the Training Director here at EllieMD. So today we're excited to welcome three guests to tell their real journey, real results experiences. We have Jennifer Lewis, Corey Brooke Cooper and Jonathan Alamo. So guys, thank you for being here and welcome to the call. And we're super excited to have you here, super excited. But I am going to start with Jennifer. Okay, I'm going to come to Jennifer first. So Jennifer Lynn Lewis, she hit early menopause at 37 while raising three kids and teaching second grade. She was feeling exhausted, she gained weight, and she completely disconnected from her body. I'm sure, ladies, you can relate to that. Okay, now she's 51 years old. Okay, and after years of trial and error, she feels stronger and more energized and more confident than ever. Today, Jennifer is dedicated to helping other women turn midlife into their greatest comeback. I love that statement, helping women turn their midlife into their greatest comeback. So welcome, Jennifer. Thank you for being on the call.
Hello, everybody. Thank you so very much for having me today.
Oh, it is a privilege. We can't wait to hear your story. So tell us a little bit about that. Obviously, you hit menopause at 37. That must have been quite huge for you.
Yes, I just had my third child at 34. So 3 years later, things started happening again, and I had no idea what I thought it would be menopause. But I was always a cold person, and I was having these weird hot things happen to me in the middle of the day. And while I was sleeping, I didn't want all those covers on anymore. And I was getting very irritable. And I'm like, this can't be. So I kept going to the doctors. And of course, I'm 37. They didn't think it was that either. So I had lots of doctor visits, lots of blood work done, and they really didn't know was wrong with me. But then the scale kept going up and up and up, and I was losing hair, just all these weird things. So they said I did have symptoms of early menopause, but they just couldn't believe it, that it'll be so early. Little did I know, my mom and my grandma were also 37. Yeah, years old. So I didn't change anything. I kept creeping up on the scale. I always exercised. My husband and I, that was kind of our date night every night. After I taught school, we would meet at the gym and we would exercise. So I was still doing that. I had taken off the baby weight, eating the same. So I felt like I tried every supplement out there. And yes, I would lose 5 to 8 pounds, but nothing sustainable. I didn't go further than that. And I just wasn't feeling like I was getting anywhere real quick. And then I would gain more afterwards. Right. So I wound up gaining 50 pounds at the age of 51. Back this September was my highest weight. So it was subtle after through the years, but it was a lot. In between menopause and all the symptoms, I also wound up having 3 traumatic car accidents. So I was hit by a soil erosion truck while I was sitting still, and I had to have 2 discs replaced in my neck. And I also was hit, my husband and I were hit by a tractor trailer, and we're very lucky to walk away from that accident. And I had to retire from teaching at that point. So not only was I having these menopause symptoms and some brain fog and all going on, now I had brain trauma. So I really did feel like I was at a loss with my body and I didn't know what to do. And I kind of just wanted to give up and think, you're 51, this is what you have to deal with. So I ran into someone that I hadn't seen for a while, and she looked fantastic. We had lunch together, and I kept wondering what she was doing, but it's kind of weird to ask. And I got up the courage and asked her, and she told me that she was doing a GLP-1. And I had seen those Ozempic, Wegovy, all those kind of commercials. And I was like, just thinking it was diabetes. I wasn't thinking that was a thing for me. But she said she was doing it. She felt great. She looked wonderful. And I'm like, well, maybe I should start to research. So I was one of the lucky ones. I found Ellie first. I didn't try anybody else. Ellie and I were married together for the first shot. So literally. And I started with tirzepatide, and I've been using it since September. And I was seeing little things like on the scale, the inflammation was going down. My legs weren't swollen. I wasn't feeling achy and my joints weren't hurting. I wasn't needing a nap at 3 o'clock. And I'm down now 39 pounds. So almost the whole 50 pounds from my menopause, which is amazing. And then my unbelievable story with the NAD, I would like to share real quick, if that's okay. I started that a few weeks later. And when I got hit by that tractor trailer, I had gone through a big 2.5 hour test. And I was at a 1% memory for cognition and memory. I could not repeat three numbers in order back to my doctor. I was hysterically crying. I was so emotional. Math was always my forte. And of course, I was a teacher. And they said it was going to take time. They didn't know if it would come back. But I gave it a year. I went through all the therapies. I went through all the concussion specialists. And they did say I had to retire from teaching early. So I found out about NAD, I guess, 2 months after I retired. August, I retired. In October, I found out about NAD about a month after I started tirzepatide. And about 6 to 8 weeks in, I went to my concussion doctor. He told me the 3 words that you have to say at the beginning of a session. I went through the whole exercise with balancing and such. And at the very end, I could repeat those 3 words. I was so emotional. I couldn't believe it. My doctor said, Jennifer, what are you doing? Like, you haven't had this change. I've seen you for a year. And I told him I added this peptide. And he was beyond thrilled. He said that was definitely it. He knew all about it. He didn't know I was taking it. He knew all about NAD. He just couldn't believe the changes. I could remember and 3 little words like apple, pencil, and sink. I couldn't remember before, but I had the brain fog was gone. The mental clarity was gone. I had that back. My focus was back. I remember things now. My kids don't say, Mom, use your words when I'm talking, because I couldn't find them before. So the menopause symptoms are amazing as well. I don't have those hot flashes. I don't have the anxiety attacks. I'm nice to my family again. I don't need a 3 o'clock nap. So I just feel like a new woman. My brand pillars are resilience and renewal, because I feel like at 51, you can still be having fun with your family, not be sitting on the couch, get ready for the grandchildren, and just still enjoy your life again.
Oh, I love that. And that must have been such an emotional moment for you to be able to remember those 3 words.
It was so emotional. I was in tears. Called my mom as soon as I got in the car. I was so excited. So
Yeah,
such
I
a
can't
little
even
thing.
imagine.
Yeah.
So obviously you've been taking a few other peptides as well. So you've been taking the GLP-1s, you've done the NAD plus, and then you kind of introduced the sermorelin, the B12, and a few of the other peptides. So how did they kind of impact you as well?
I was really afraid about losing muscle mass because of my neck injury and my body injury and still healing. That I started the sermorelin, and I haven't been to the gym yet, but I do walk, and I have like that definition in my legs where I don't think I've had since I was in sports in high school. So that's quite a long time. So that has been a real lifesaver for me. It also has helped me with sleeping. And B12, that helps. I thought that was only energy. That's helping me with sleeping as well, which is fantastic. And the BPC 157 has been a wonderful on my joints and my neck. I don't have to see the chiropractor only once a month now. The pain and the motion, the range of motion has been wonderful. So I've been so fortunate for the timing that I found this peptides and Ellie.
Yeah, it really does sound it. And we're so happy that you kind of have overcome all of that. You've been through quite a lot. So obviously you take quite a few different of the peptides. So talk to us a little bit about your routine with them. Is it a weekly thing, a daily, or how does that work for you?
Sure, absolutely. I take the tirzepatide. I take that on Saturdays, the GLP-1, and I take um, the BPC and the NAD together on Sundays, Tuesdays, and Thursdays. So 3 times a week, I split that up. And then the Samoralin I take Monday through Friday and off on weekends. So it's super simple. I actually have a little magnetic calendar next to my refrigerator with all our dinner schedules and then my shots right next to it. So super simple. I'm obsessed. I used to pass out at needles, and this is the tiniest little thing. And if I can do it, anyone can do it.
Oh, I love that. A lot of people are afraid of needles, so it's really good that you've said that. So obviously that was your big wow moment was the NAD plus. Obviously you remembered those three words. Like I can't even imagine putting that into words what that felt like for you.
It was absolutely amazing. I couldn't believe it. I didn't think I didn't think I was going to go in thinking I would be able to repeat them. I really didn't. I had no idea the healing of my brain that had happened in those 6 to 8 weeks with the NAD.
Wow. That's incredible. Well, thank you so much for coming on and sharing that story with us. You know, that's quite an impactful story. You've been through a lot. So thank you so much for coming on and sharing that with everybody.
It's a pleasure. Like I said, I love to share with anyone that can relate or resonate or anybody you know might have the same issue. So thank you so much for having me.
So next up, we have Corey Brooke Cooper. Now, Corey is a pharmacist, a life coach, and master certified health and nutrition coach. With more than a decade of experience, she teaches women how to stop sacrificing their health for other people's priorities. But as a busy working mom, juggling everything, she fell into the same trap that so many of us do. Grabbing whatever was quick. How many of us do that, right? Skipping workouts and running on fumes. Then came the wake up call, okay, a pre diabetes diagnosis. And given her background and family history, she knew exactly what that meant. And it scared her. It scared the crap out of her. That's exactly what she shared with us. It scared the crap out of her. So that's when she realized that she realized she had GLP-1s all wrong. So welcome, Corey. Tell us a little bit about that story.
Yeah, thanks so much, Laura. Yeah, I'm so glad to be here with you all and be able to share because I was always skeptical and until I had my own wake-up call with the prediabetes diagnosis, that changed everything for my perception on how I thought about using peptide therapy. So, as you mentioned, I am a pharmacist, and so I'm supposed to know all these things, right? I'm supposed to know how to take care of myself, and I'm supposed to help other people take care of themselves. I mean, that's what I basically built a business around. But what was happening was that I was not able to find the time. So I was juggling the same busy schedule that a lot of you probably are. So I had a busy full-time job. My husband worked full-time. I had a son who has a very busy sports schedule. So he definitely keeps us moving. And I was falling into that trap of not taking care of myself, eating on the go, not sleeping, pretending that I was getting rest when I called myself taking a quick nap. And none of that was actually working. And so one day I had my annual checkup and my doctor said, "Hey, your A1C is up." And she didn't say pre-diabetes because she and I both knew what she meant by saying that my A1C was up. And I have every family member on my mother's side basically has type 2 diabetes. And I know that once you cut those genes on, it is hard to cut them off. So it definitely really scared me to think that that might be the path that I was headed down because I wasn't taking time to take care of me. And so I did the things I knew how to do. So I started to change how I worked out so I could help combat that insulin resistance that happens in diabetes. I changed the foods or even the way I put food together so that it kept my blood sugar stable throughout the day. I tried to get more rest. That didn't quite work out, but I definitely made the attempt. And so my blood sugar got better. So I was able to control my blood sugar, but for some reason, I wasn't losing the weight. And that just didn't make any sense. Like if you're doing all the things that would help to support decreasing insulin resistance and help to improve your blood sugar, you should, in theory, lose weight. But for whatever reason, I wasn't. And so it was then that I said, okay, maybe there's something different I need to pay attention to about GLP-1s that I was kind of biased too. I mean, I started using GLP-1s in I had a diabetes practice back when GLP-1s were first approved, so back in 2005. So I used them for type 2 diabetes, and I looked at them as a tool for vanity weight loss. That was how I viewed them until I got to this place of not understanding why it wasn't making sense, why I could do the things that I'm supposed to do that I know for years have worked to help people lose weight, but it wasn't working anymore. So I was real. So I did what any pharmacist would do: go dive into the research, go read the new studies, go catch up, go review all the data. And I just decided, I'm going to try the GLP-1. I tried particularly the GLP-1 GIP, so that I could better understand, the benefits that I was reading about. And what I found was an amazing tool that literally has been a game changer for me personally and for now people that I have had the opportunity to share this with. So I told you the blood sugar changed, but my weight didn't. So as soon as I started the GLP-1, GLP-1 GIP, which is tirzepatide, I was able to see changes in my weight. I've only been on the peptide for 8 weeks. So it's been a total of 8 weeks. And I've only been on the full dose because I started slow. I started slow for the first 2 weeks. I've been on the full dose for 6 weeks. And in that time, I've lost almost 14 pounds. I have lost 2 inches across my chest, 2 inches across my hips, an inch across each arm. I have, and I couldn't buy 13, 14 pounds for the past year that I had been trying to make sure that I was able to keep my blood sugar under control. And of course, by doing so, lose weight. So in this short amount of time, I'm able to see not just the changes in the scale, but also the changes in just body composition. And to me, that's probably been the most powerful thing because some of the, I guess, scary things you hear is people say, "Oh, I don't want to lose muscle," and so they get worried about that. But I'm not losing muscle when I'm losing these inches. That's fat. That is shrinking fat. That's fat called fat oxidation, and I'm getting that in such a short amount of time. So these peptides are something that I think that I have really changed how I talk about them with people. I'm excited to share, especially through the opportunity with EllieMD and having access to multiple peptides. So I was hesitant to start the GLP-1, and now I dove right in. I'm probably on about 4 or 5 now. But I definitely love the peptide space, and I'm just so excited to be able to share this with people and be able to share, even a little bit of a transformation in a short amount of time that I struggled for years to see.
Yeah. So you're taking the GLP-1 slash GOP, you're taking the NAD, and you're taking the BPC. So what was that like moment for you where you kind of thought, I'm finally feeling like myself again? Did you have that moment?
Yeah, so probably about three weeks in. So it was probably after my first full dose of the GLP-1 GIP. I was kind of like, oh, this feels different. I felt when I was working out, it didn't feel like as much of a struggle anymore. So there were certain, like, I would be exhausted trying to work through some of those strength training exercises when I first before I started on the peptide. But then now I'm able to move through them easier. I I thought I was going to have a decrease in energy when starting the GLP-1 GIP peptide. That was kind of why I added the NAD in. And then surprisingly, so kind of like Jen, there was this unexpected benefit to NAD that I started to notice my hair started to grow in fuller and thicker. And I was like, oh, this is a nice perk, because I wasn't expecting that. So that's probably been the main thing that I have noticed by adding in the NAD is just the change in how my skin looks, how my hair looks, how I'm feeling. And so, I mean, every day I work long days. Y'all see me, I'm in my hotel room right now. So I'm traveling all the time. I keep a pretty full schedule and I've been able to really, handle all of that with the support of these peptides.
Yeah. So talk to us a little bit. Obviously, the GLP-1, it helps with the food noise and cravings. So did it help you with that side of it?
Yeah, I definitely noticed as soon, especially on the day that I took my peptide, like I that day I really had there was no sensation really to want to eat. I mean, obviously I would plan to eat my breakfast, lunch, and dinner, but the decisions I made and the way I put those meals together was very different because I wasn't distracted by thinking about like, oh, what time is it? Like I used to always have to like plan well, what time is it? It's the middle of it's 12 o'clock, so I'm not gonna be able to eat again until 5 o'clock. So should I take a snack at 3 o'clock? Like I'm having like you do all this mental gymnastics around meal planning and the food that you should eat because you're just so preoccupied with it. Because you're taught that you have to eat at certain times a day. You're taught that you have to have a certain protein consumption per meal at certain intervals. Like, yeah, look, all of that stuff is just too much for people who are trying to just function in a regular world and function and do all the things you need to do on a daily basis. So that distracts you from being productive. It distracted me from being productive on my job. It distracted me I would buffer. I would buffer doing stuff I was supposed to do because I was so worried about the food stuff. And so I will definitely say that the distractions, the preoccupation with food, the preoccupation with worrying about what I was going to eat and how that would impact my weight. Because remember, I told you I was doing the things to help my blood sugar, but I wasn't losing the weight. So I became literally over preoccupied with with the foods I was eating because I couldn't figure out why the food I ate didn't help me to lose weight. So definitely there was all that sort of mental nonsense went away. And I was just really able to focus on doing the things I should be doing during the day and using food as a tool for energy at the times that made sense for me.
Yeah, absolutely. So you kind of answered my next question with that one, but obviously you are a pharmacist, and how do you explain peptides like in a way that feels approachable?
Yeah, I think one of especially because of the marketing and the media around the medications that are currently available to support weight loss, I think people don't quite understand that peptides are not these artificial medications that were created that you now use to either treat diabetes or help you to lose weight. That your body produces peptides. These are hormones, these are peptides within your body that you're already producing. And so this sort of commercialization of them makes people think, oh, it's a medication, so I have to worry about side effects, I have to worry about dose, I have to worry about all these things. And so I just tell people, look, it's kind of like a lot of people can relate to diabetes. Diabetes is obviously a well-known problem in this country. And so a lot of people relate to the story of insulin, that some people need insulin and some people don't. So if your body needs insulin, you give insulin to help your body do what it needs to do naturally. So that's what I tell people. Peptides are kind of like that. You are using what your body maybe it doesn't have enough peptides to do what it needs to do for you. So maybe it's inefficient, or maybe you just aren't producing the amount that you particularly need. So you supplement your hormones with exogenous hormones or hormones outside the body, basically to help your body do what it's supposed to do naturally. So a lot of people relate to the insulin story and understand that insulin helps people to lower their blood sugar because they can't do it on their own. It's kind of a similar thing as how I think of just using peptide therapy. It's your body needs support. It's a tool to help your body do what it should do naturally.
Yeah, that just sums it up right there. It really does. Thank you for sharing that. And thank you for coming on and telling your story. We're super grateful that you shared your story. Thank you.
Absolutely. Thank you.
So next up we have Jonathan. So Jonathan Alamo is a 38-year-old food and beverage industry professional with a passion for wellness and transformation. Over the past year, the GLP-1s have been a life-changing tool in his health journey, helping him lose over 85 pounds, and regain confidence, energy, and balance in both personal and professional life. So welcome, Jonathan.
Hi, how is everyone?
I think everybody is great. Oh, we're super excited to have you here. So, Jonathan, tell us a little bit about your story and why you decided to take a risk on the peptides. What did they do for you?
Absolutely. Well, first of all, I'd like to thank you guys for inviting me to speak today because to me, this is a true honor. I'm obsessed with talking about this. I think that, we finally found an answer that's really working for people. I'm going to kind of start from the beginning, if that's okay with you, Laura.
Absolutely.
I come from a family of obesity. My mom had gastric bypass surgery at the same time Al Roker did. And I remember it was just like this hidden thing, like, hey, I'm going to go have this quick surgery. And it was just a huge thing, right? Like I remember her, you know, being sick all the time from this. And so it's something that my entire life I've really had to take the bull by the horns. And I didn't. I mean, if gaining and losing weight was an Olympic sport, I promise everyone here I would be a gold medalist at it. And I knew how to do it. I knew how to lose weight. It became for me like a yearly thing where I would lose 50 pounds by starving myself. I mean, literally, there's no better way of putting it. I was eating dry chicken with no oil, no anything on it, and vegetables, and every meal of every day. And I would feel weak and I wouldn't sleep and I would be absolutely miserable, but I was losing weight. And the second I switched and ate that plate of nachos, it didn't stop. I went on and on and on. So that 50 pounds that I just lost, I would then gain 80. So it was coming to a point where, to be honest with you, once I hit probably 240 to 260, then I would get scared because I watch my 600-pound life religiously. And I know that I'm going to be on that show if I don't stop. So it was a vicious cycle. So then I would scare myself. COVID was a huge one because I put more weight on than I ever had. And I'm just like laying there in bed and just feeling so miserable, but continuing to feed what I truly feel like now was an addiction to food. I was obsessed with it. Dr. Corey, I admire you so much. You put it so perfectly, though. Like my brain would revolve around where that next meal will come from or where the next drink will come from. I not obviously, but I previously had a really complicated relationship with alcohol as well, prior to these medications. So I realized that I was kind of drowning out these sad, miserable, depressed feelings, trying to put on a happy face. And when I'm drunk, I'm fun, And so I was giving this version of myself to my friends, and nothing's wrong with me. Don't worry about it. Now just yesterday, literally a picture came up with a friend, and I sat there and I just started tearing up because I can feel how sad I was back then. I can feel all those feelings. I was with my doctor last April, and we had talked about it before. We had talked about it the year prior of me going on GLP-1s, and it was really super new to prescribing this for people at the time. And I just, I didn't know anyone who was doing it, and I didn't want to be the guinea pig. And it was kind of like that. And then I'm sure a lot of you can relate. Oprah came out with that episode, and I watched that episode and I was like, that's me. Like, she is speaking directly to me. I'm like, get me my next doctor's, but like, I need to get on this, and I need to see what the hype is about, because if I can put a shot in my stomach and I can lose weight, why not? Right? Like, I am a risk. I'm totally ready to do it. So, I went on it immediately, and it's so crazy, but you guys know what I'm talking about. Like, I felt it instantly. The food noise was probably the first thing. And it was like, wait a second, I don't have to have that bag of Cheetos, but then the alcohol came to me, and I'm like, I'm not in the mood to drink. I've never in my life not been in the mood to drink. I've never in my life not been in the mood to eat. I've never passed that plate of nachos. Obviously, nachos are my favorite food. Now I could take it or leave it. It's just the mental part of this is absolutely crazy. I tell people, like, I feel like I woke up skinny. Like, how many of you guys have counted points or calories? I'm telling you, any crazy diet that you could possibly think of, I've done it. And I hated every minute of it. I've done things in different multi-level marketing companies to prove that this is how you lose weight, and it's not. And I'm here to say that. Like, so when this was introduced to me and I heard about Honey creating this company to share this, absolutely genius. Number one, because when I started, who did I ask questions to? Right. Like I can't call my doctor and I mean, I'm sure I could, but not at 9 o'clock at night when I'm like, why am I feeling this way? I had like two friends who had done it and I didn't really want to bother them. And I just kind of felt like alone in the dark. Right. I had the pleasure of catering a retreat for EllieMD a few weeks ago. And that sense of community that you guys have here is priceless because I'm getting chills as I say this, all these people coming together with the common thing. And we know that we have a tool that actually works to change people's lives, right? And I know you guys, probably most of you on here, have also tried other things. And it's like, for the first time, can be so genuine in my life by saying, this is what I did and this is how I feel. And I have such a passion for helping others with this because it's amazing. I wish my mom has passed away several years ago. And I'm just like, I wish so bad she was alive right now to experience what this is and what it's doing for people. But the thing is, there are a ton of other people trying this. They are not EllieMD because they don't get this sense of community. And it's super risky what people are willing to put in their bodies right now and not know, right? We stand behind a product, we stand behind Honey and everybody who's put their hands in this to create an amazing product that we know is giving results. So for me, it is super refreshing to know that I can lead people in a direction that for the first time in my life, I truly, truly, truly believe in. See, I didn't want to prepare anything to say, and I just wanted it to come all naturally. And that is truly, I don't know how this works with this, but I did pull up a picture of, that miserable guy who wasn't ever happy and it went away. But if you go to my Facebook, you can see it. I just am so want to get this in everyone's hands who need it. And to have that avenue that you truly trust and believe in is remarkable. I think that this company is amazing. I think that the community is even better. It's like you have people to rely on. Again, I had the pleasure of meeting Dr. Corey just so casually, kind of comparing our stories. And I remember telling her, like, this is the beginning for you. Like, just wait and see what this is going to do for you. And for me, the physical part of it is obviously amazing. I've lost 85 pounds. Stronger is the mental part. Stronger is knowing that I don't have to yo-yo diet, that I don't have to starve myself to look good, that I don't have to go down these crazy avenues that at this point in my life, I'm embarrassed that I did. But I'm also good with knowing I have the tool. It's right in front of me. I'm using it. And I want to use it out loud. I've never been a person, and I know that there's a lot of people, it's totally okay, who are kind of in the closet or shy about admitting that this is what they're using. I want everyone to know that this is what I'm using because I know how much it can help them too. Anything else from me, Laura?
Oh, I love it. I love it. You're so passionate about this. And I know firsthand how much this has changed your life. I remember I spoke with you months ago when you was on this journey, and it has had a real impact on you. But
Laura,
I
that
want
was
to
like
know,
50 pounds
obviously,
ago too.
yes, but you are in the food and beverage world. Okay, you're around food and drink every day. So how do you stay consistent? Has that noise just gone for you?
I was thinking about that too when the others were speaking. Honestly, yeah, this sounds crazy probably, but my mentality is always like, no, I'm okay. Like I'm good. Like I don't want that pizza. And I genuinely don't. Like before, when you're dieting, you're like, I don't want that pizza. I would love to have 10 slices of that pizza. You know what I mean? But I'm just like, I just don't. I'm not tempted by it anymore. And I think a lot of that is because I know I can have it, right? Like when you're dieting forever and you eat that plate of nachos and you're like, this is so freeing. But this time it's like, I can have the nachos if I want it. I truly don't. Or maybe I want to have a little bit. You know what I mean? Like, I literally just got off the phone telling my best friend this story. I haven't been to our employee cafeteria in years. I went today. Before in the employee cafeteria, I was on this side where the salads and the vegetables, and I was eating like that all the time. Not to say that I don't still truly enjoy that stuff, but I was eating salads with no dressing. And, just trying to count every point or every calorie of this. I went right over to the grill today and got a chicken sandwich with bacon and cheese and French fries. And you can do that. Like, it's okay. I guess I feel so freed to not be part of any plan or counting or tracking or anything like that. It's truly, I definitely did want to say that. I always felt like when people say, like, you need to listen to your body, that was like gym rats and stuff who say that. This is the first time this past year that I truly get it. Like, I'm listening to my body. Like, I will crave protein when my body needs protein. And my husband's a sourdough bread baker, but everyone's like, how do you stay around this and not eat? I eat the bread every day. I eat the bread and I'm skinny. Like, it's just that. Like, sometimes I need carbs in my body. And yes, it's taught me how to properly eat and not go crazy, because I wouldn't stop at one slice of bread before. I would eat 20. I mean, I would keep going and going. And where's the queso? Like, it's freeing to know that you don't have to be constrained. And that's what for me and my life, freedom is probably the best word that this medication has brought to me.
Yeah. Oh, I love it. I love it. And I love that you still eat the things you want to eat. That's
Always.
great. I love that. I hear that a lot. People are like, I shouldn't eat it, but I want it. So I'm just going to eat it. And people do, and they're still seeing the benefits.
Laura, do you
So
mind if I
love it.
elaborate on the alcohol part for a second? Because I do want to go back in case anybody had any questions. I do. And people will ask me all the time. So do you still drink? Yes, of course. I was in Mexico a few weeks ago having shots of tequila. It's the same with food for me. It completely, and I tell everybody, if at that time my doctor would have told me I wouldn't want to drink anymore, I would have never taken that first shot. But I didn't know that, and it happened organically, and it's created such a better version of myself and that's why I want to give back to the community and show people, like, this is what it can be like. And I'm here to hold your hand, and I want to celebrate your stories with you, because that fuels me so much to hear. I'm getting choked up. Other people succeed in this. So no, it's not like I went from completely, alcohol all the time to no, like, it's moderation. I've never known moderation in my 38 years on earth. And finally, now I get it.
Oh, I love it. Thank you so much, Jonathan, for coming on and sharing your story. And thank you to all of our guests. So we had Jonathan, Jennifer, Dr. Corey Cooper. I mean, each and every one of you has an amazing story that resonates with somebody. Okay, somebody has been through and on that path that you was on before you was introduced to the peptides. So thank you so much to each of you for coming on and sharing your experience with us. And we do really love hearing all these amazing stories. So thank you, each and every one of you. And thank you guys for tuning in and listening to their stories. I hope it's really opened your eyes to the power of what peptides are about. So that does conclude our Thursday educational series. And we will be back next week with another story, another version of how these peptides are helping people. So thank you, everyone. Take care. Enjoy the rest of your day. And we will see you next week.
Thank you.